I am the founder of Gut Well. My name is Jennifer Tanner. Today we are going to be talking with the brilliant Sophie Ash. Hi, Sophie. How are you?
Hello. How are you? I'm excited.
Great. Great. So Sophie and I, we were introduced a few years back through a mutual friend while I was living in Spain, and I've just kind of enjoyed our visits ever since. So I thought you guys would get a kick out of what Sophie has to say. Today, we're going to be talking a bit about IBS, but let me read you Sophie's bio. So Sophie is a nutritionist, former dietitian, and medical writer specializing in digestive health. She's the instructor of the popular online course, The Fundamentals of IBS Management, and teaches gut healing workshops throughout Toronto. So Sophie, tell me a little bit about yourself. Why is IBS important to you?
Yes. So when I was a dietitian, I was suffering from IBS myself, and I was, of course, learning how to help people manage that condition within the healthcare system back in the UK. And then I was going into clinical practice, and I was kind of using these recommendations on my patients, and I was struggling myself, and I wasn't seeing great results with them either. And just over the years, it kind of became my mission that I was going to do every test that I could find. I was going to try every treatment, every diet, every possible thing that could help me. And then when I did further training in nutritional therapy, I learned kind of other techniques and other ways of understanding the gut and how the systems interact. And just, I finally started to figure out how to manage my condition, and then I was able to help other people do that, and it was just really rewarding. And yeah, just having been through it myself, I could relate to what my patients were going through. So that's kind of why I ended up specializing in it.
Yeah, so you do have that personal connection to this. It kind of drove you towards finding some more answers. So tell us a little bit about those answers that you found. What is IBS, irritable bowel syndrome? What is it?
Yeah, so a lot of people don't even realize they have IBS because the definition can be hazy, or it doesn't necessarily get diagnosed. But it's essentially the name for the collection of symptoms, most of which are digestion related. So nausea, bloating, abdominal pain, constipation, diarrhea, flatulence, indigestion. All those things are collectively IBS. And so IBS stands for irritable bowel syndrome. So usually people have between 4 and 5 of these symptoms kind of on and off all the time. And it can be really debilitating, and it can be something that, you know, it does affect your quality of life, and it's difficult to manage, especially because sometimes, you know, whatever is triggering it, you don't see the symptoms or the reaction until much later. So it can be really hard to pinpoint what's going on. It's mostly women who have it, but it's very, very common. You know, I'd say everyone's experienced it at some point, but some people have it chronically for, you know, year after year after year, and they really struggle with it. So yeah, essentially, you know, if you have a few of these digestive symptoms, then you have IBS, and it's not necessarily recognized as a medical condition. Kind of, once you've ruled out all the more serious things like bowel cancer or inflammatory bowel, the things that will come up in the medical diagnostic test, then they'll kind of say, oh, well, we think you have IBS because you don't have any of these other things, and it's not necessarily treated that seriously within the medical community. So it's important that people understand it themselves and advocate for their own, you know, to get the help that they need. And that's kind of where I come in.
Okay, so it's basically a diagnosis of exclusion. You have a lot of these different symptoms, and it isn't pinpointing to any one specific disease, so that rules out everything else, and you're kind of left with the diagnosis of IBS, right? That irritable bowel syndrome. They've ruled out some of those more serious conditions, and you're just left with like basically a digestive mess. Right? So why is it so difficult for somebody to manage their IBS symptoms?
Yeah. Well, sometimes there isn't a medical explanation for them. I mean, there's medical tests you can do, but there's also private tests you can do. And even within that, you know, when you've expanded the range of testing that you're doing, sometimes nothing will show up as being abnormal, but you're still feeling as though something is wrong and you're still experiencing the symptoms. So trying to pinpoint what is actually going on can be really challenging. And, you know, that is one of the most difficult things, I think. And you know, then there's the whole kind of conventional medicine versus functional medicine. And, you know, functional medicine looks at like the way that the body is functioning and how all the systems interact with each other. And there's a whole array of other tests and investigations that you can do within that a lot of people aren't aware of. So if they've just gone to their physician or maybe a gastroenterologist, they may not have been even exposed to these options. So that's kind of limiting them in understanding what's going on. Another reason is because a lot of medications that people are taking have side effects that can cause IBS. So it's really common to have constipation, diarrhea, nausea as a result of medication. And a lot of people don't realize this. And if a drug is introduced at a time when there's also a dietary change or there's a lifestyle change or change in stress, then it can be really difficult to pinpoint, you know, what is causing the symptom. And some drugs, even for IBS, can cause IBS. You know, some things are supposed to help and they can actually make it worse. And so I think not many people realize that there's no one-size-fits-all approach. It's very much an individualistic thing. And so I think that is one of the biggest challenges that people have. And the other thing that I would say is if the healthcare practitioner hasn't had IBS themselves, or if they don't specialize in that, a lot of practitioners will just see, you know, hundreds and hundreds of patients, and they'll kind of just want to get people in and out the door as quickly as possible, and there isn't necessarily a chance to have a conversation about it, or it's not necessarily taken as seriously as something that is known to have really serious health risks or to put a strain on the system further down the line. And so people can just feel like neglected and misunderstood, and it can be hard to find someone who actually specializes in this and takes the time to talk things through and help.
Okay, so interesting. So you're finding that, you know, because these symptoms aren't life-threatening, they're more discomfort, right? Like we can still live with these symptoms, although it's not ideal. That maybe we're not getting enough education to recognize and understand what's happening, and or maybe not enough treatment options. So one of the things you mentioned was looking at those own lifestyle things. Is it something like a change that's happened within ourselves, a stress change, a lifestyle change, a dietary change, or a medication change? Were one of those the onsets or triggers for the beginning of these digestive symptoms? So what would you say, in your opinion, what's the number one thing that you'd recommend for someone to try if they do have IBS?
So something that I have made a huge difference with my own IBS and also with my patients is just giving your digestive system a break sometimes. You know, like a lot of people are eating all the time. Like food is readily available these days, and it's easy to just keep snacking, keep picking at things. You know, there's buffets, and that, you know, just continuously putting a strain on your digestive system, it's just giving it work to do all the time. And so I find that just taking a sustained period of time where you don't eat and you just, you know, drink plenty of fluids and just let things kind of process and let the gut kind of heal on its own, because it wants to do its job and it wants to recover. But if it's constantly working really, really hard, it doesn't have that time to do so. So, you know, some people find that they feel a lot better if they don't have breakfast, for example, and they go straight through to lunch and then dinner. Other people find that it's better if they do eat small, frequent meals. But then, you can still have a period of time from the evening through to the morning where you don't eat anything and just kind of cleanse everything. It can take some self-restraint to do it, especially if you have habits where sit in front of the TV and you're always snacking, or you just have things laying around the house all the time. But it really can make a big difference, and it doesn't sound that significant, but when you actually do it consistently, I always recommend that people give that a try.
So it sounds a little bit like intermittent fasting. Is that true?
Exactly. Yes. Yeah. And I mean, there's a lot of stigma around that and what that means, and a lot of people try to do that for weight management and other various things. But yeah, that's essentially what it is. There's like a window of time where you eat, there's a window of time where you don't eat, and just kind of like, it just helps the system kind of regulate itself and just helps bring things back into balance more naturally.
Okay. Yeah. So with intermittent fasting, usually we're having people pick a start and a stop window. So would you recommend, like maybe for the first week or two while somebody's exploring this, picking a certain time of day or night? So just say like 6 p.m. I'm not going to eat anything after 6 p.m. until, let's make it a 14-hour window until 8 a.m. the next morning. Would that be a good way for somebody to start? And then they could adjust it as needed based on like what hours and times of day they felt better having a bit of an intake break?
Yeah, I mean, it really depends on the schedule of the person. If you're a night person and you're not going to bed until like 1 a.m. or something, then 6 p.m. might be a bit early, because if it's unrealistic, then you're going to find like a couple of hours before you go to sleep, you're going to want to eat something. And so, yeah, I mean, I tend to sort of look at where I usually go to sleep and then count back maybe 4 or 5 hours from that time. And that's a pretty good time to start the fasting.
Okay.
Or yeah, like I said, if you find you're more of a morning person, it could be more, it could work better to just get up and start getting on with your day and just try to postpone the first time that you eat as long as possible, and just be hydrating. And a lot of people go to the gym in the mornings as well, so that it can help with that. So yeah, I mean, think of something as a starting point that works well with your schedule, and then adjust accordingly.
So during that no eat time, no foods, but they could have fluids?
Yes. So anything like herbal teas and coffees and waters, and I think just as little as possible, because as soon as the body has to start breaking things down, then everything's going to be still being triggered all the time. So it just just cleansing and just fluids. I think it would make a big difference.
Okay, yeah. I mean, a lot of people will find that taking breaks from meals like that, it creates a bit of a metabolic reset. So you mentioned body composition for people who are trying to shift that a little bit, like gain that muscle mass, drop a few pounds. It can start to reset that system and keep that in place. But really what we're doing it for here is that digestive relief. So that organ can get a bit of a break from all that onslaught of irritation that it's receiving on a daily basis. Now, you have the Fundamentals of IBS course. Tell us a little bit about this course that you have.
There's a lot of practical checklists as well. So, for example, there's a checklist of all the tests that someone could have to identify what is going on, and they can take that to their practitioner and say, okay, these ones I've already had, these ones aren't appropriate based on what they've learned in the course.
Oh, this sounds like a fantastic resource for people that offer a little bit of education and support throughout this process. Thank you, Sophie, for putting that together. I'm sure a lot of people would appreciate having some of that information at their fingertips.
Yeah, I know it's something that I would have found really helpful when I was struggling a lot. So it's great to be able to, get that out there and support other people who are going through it.
Okay, great. Just to recap a couple of the things that you spoke about. One, recognition, because these symptoms aren't textbook. Not everybody has diarrhea and constipation, or one or the other. You know, everybody's symptoms vary slightly. So recognizing that any sort of digestive upset is not normal and that we should have it checked out, and we should keep asking those questions until we get an answer, until we rule out some of those more serious diagnoses. But your number one tip is looking at stop eating. So giving that digestive system a bit of a break. Sophie's guidelines are she starts about 4 to 5 hours before she goes to bed. She kind of backtracks a little bit, stop that mindless kind of snacking and onslaught to our digestive system. And then looking for resources like her fundamental program, something that's offering you, those education tips, those guidelines, those checklists, those charts and whatnot, to give you a little bit of understanding, a little bit of resources, know what to ask for when you go see your MD. And definitely, I think Sophie, she wants people to know that you are not alone in this venture. Sophie was someone who has suffered from this herself and has kind of navigated the system and found ways to cope and manage those symptoms. So Sophie, is there somewhere where people could reach you if they want more information?
Yes, the best place would be to email me at sophie@prospology.com. That's PROSPOLOGY. And then I can answer any questions that they have, point them in the direction of the course, or any other resources that they might need. Email is the best way to reach me.
Wonderful. And we'll have a link to Sophie's program as well if anybody's interested in checking that out. But thank you for coming on today, Sophie. I really appreciate that tip, and I think it's an easy one that we can all implement and give a try.
Yes. Well, thank you so much for having me on. I love to be able to help and teach and, pay it forward. So, yeah, thank you.
Wonderful. Okay. Bye, everyone.
Bye.